Hello everybody. We'll be discussing body water, its distribution and management. So all of you know that in adult person 60% of body weight is due to water. So 60% of body weight is due to water. Protein is there 18% of the body weight, fat is 15%, and you can see minerals and glycogen, they constitute 7% of the total body weight. So this percentage which is given in this table, this is typical of a male adult person. But for a female adult person, the percentage of body water is little lesser than that of the male person, because in female the fat percentage is little more. Similarly, the protein percentage is a little lower. So water is approximately 50% in case of female, so little lower. Protein is also a little lower, but fat percentage is more in case of female. And these minerals and glycogen, this is almost normal with that of the male in case of female person. Similarly, if you look at the body weight distribution according to different organ system, okay, most of the body weight of a person is due to skeletal muscle mass. 36% of body weight is due to skeletal muscle mass, right? Non-skeletal constitute 29% of the body weight, adipose tissue 25% of the body weight, and bone constitute only 10% of the total body weight. So this percentage distribution, which is written in this table, are not very important for MCQ, but sometimes the simple MCQ can be given that how much is the percentage of protein according to your body weight. This has already been asked, and you have to remember protein is 18%, fat is 15%. Right. Now we are going to concentrate mainly on this water part of the body. How this water is distributed in different compartments. So we all know this thing, okay, from our very PMT level also. The total body water, which is 60% of the total body weight, right? This total body water is distributed in two compartments. One is intracellular fluid or ICF, and one is extracellular fluid or ECF. We all know that ICF is 2/3 of the total body water, and this ECF is 1/3 of the total body water. Now I am writing another one, that is ICF is 40% of body weight and ECF is 20% of body weight, right? So this is a very simple thing, okay, that ECF is 1/3 of the total body water and ECF is 20% of the body weight. But sometimes, you know, this simple thing can be wrongly answered in MCQ, so you have to be a little careful. I will show you one MCQ, okay. So MCQ was like this, that ECF is dash percentage of your body weight, and second question, ECF is dash percentage of your total body water, okay. So this water is total body water. So although this is looking similar, but these two questions are different. First question is asking ECF is dash percentage of body weight. What I have written here? I have written ECF is 20% of your body weight. So this is a direct question from here, 20% of the body weight. But second question is asking ECF is dash percentage of body water. So here we have discussed that ECF is 1/3 of the total body water. So 1/3 means that is 33%. So answer of this second question will be 33% of total body water. Getting my point? Very simple thing, but sometimes mistake can happen. So please remember this, that whenever I am writing percentage, this percentage is the percentage of body weight, right? This percentage, what I am writing here, is the percentage of body weight, okay? And whenever I am writing 2/3 and 1/3, this is 2/3 of the total body water, 1/3 of the total body water, okay? Then all of you know that this ECF is again distributed in two parts. One is interstitial fluid, which is 3/4 of the total ECF, and plasma, which is 1/4 of the total ECF. Getting my point? So this is interstitial fluid 3/4 and plasma 1/4. Now if I write according to the body weight of the person, then interstitial fluid is 15% of the total body weight of the person, and plasma is 5% of the total body weight of the person, right? So similarly, you must have to remember here, if your question is like this, that plasma is dash percentage of the body weight, then direct answer of this question is 5%. But if the question is plasma is dash percentage of ECF, then what will be the answer? We have just discussed that plasma is 1/4 of the ECF. 1/4 means that is 25%. So here your answer will be 25% of ECF. Okay, good. So this is very simple thing, but sometimes this kind of MCQ can be given. Now another things you have to remember, that is plasma is 5% of your body weight, and the total cells volume is 3% of your body weight. That means RBC, WBC, platelet, all of them comes to the cell volume, that is 3% of your body weight. So this was an MCQ, that blood or total blood is 8% of your body weight. So if you know the body weight of a person, okay, the 8% of your body weight is your blood, right? So now if you take an example here, that suppose one person has a body weight of 70 kg, okay, 70 kg. So in this person, what will be the volume of the total body water? So we just calculated that 60% of the body weight is total body water. So 60% of the 70 kg, that is 42 liter, is the total body water. Now this total body water, that is 42 liter, will be distributed in 2/3 and 1/3, that is 14 liter is for ECF and 28 liter is for ICF, right? So this way we can approximately calculate the different body water according to the body weight of the person, right? According to the body weight of the person. And what I told, how to calculate the blood volume, the total blood volume is 8% of your total body weight. Now you have to remember another formula for blood volume calculation, that is based on hematocrit of the person, right? So there is a formula, you have to remember this, that blood volume is equal to plasma volume upon 1 minus hematocrit. This question has already been given in MCQ, right? So what is the meaning of this? Meaning, suppose I am giving an example that in your question it has been given that the plasma volume of a person is 3 liter, okay, and the hematocrit, that is the PCV, packed cell volume, is 40%. Suppose a person is anemic and the PCV is given 40%. So 40% means this is nothing but 0.4. So now simply if I put into this formula, the plasma volume is 3 liter, so 3 upon 1 minus 0.4, okay. So this will be 0.6, so 3 upon 0.6, so this is 5 liter is the blood volume of this person. So getting my point. So if the hematocrit is given, okay, suppose the anemic person or a polycythemic person and hematocrit is given and you have to calculate the blood volume, then you have to remember this formula that plasma upon 1 minus hematocrit is equal to the blood volume of this person, right. So this is about different types of body water and how they are distributed. Now apart from all this type of body water, you know, there is something which is called transcellular fluid. So what I told like this, that there is something called transcellular fluid, okay. Transcellular fluid is not included in this distribution which we have already discussed, ICA, PCA, okay. Transcellular fluid is not included in this distribution. You know what is transcellular fluid? The fluid which is present in certain body cavities, okay. There are different body cavities inside our body. The fluid which is present in this cavity, those fluid are known as transcellular fluid. The examples of this transcellular fluid is cerebrospinal fluid, which has a volume of 150 ml approximately. In between two pleura, visceral pleura and parietal pleura, you know, there are intrapleural fluid. So intrapleural fluid volume is approximately 10 to 20 ml, which has already been asked in MCQ. The pericardial fluid has a volume of, okay, approximately 50 ml. You also know that there are peritoneal fluid which has a volume of approximately 0 ml in case of male person, and it is approximately 20 ml in case of female person, particularly in post-ovulatory phases, because you know during ovulation there is rupture of follicle and there are certain amount of fluid which will be ooze out in the peritoneal cavity. That's why in case of female person, particularly in post-ovulatory phase, the peritoneal fluid volume is approximately 20 ml. And apart from all these, you also have to remember synovial fluid, which is approximately 1 ml per large joint, okay, like for example knee joint or hip joint. In all this joint, the volume of fluid, synovial fluid, is approximately 1 ml, okay. So all this transcellular fluid volume you may remember for your MCQ purpose. Now we will move on to the next thing, that is body water changes along with ages, right. So you first look at this graph. Whenever you will look at a graph, first try to identify what is the x-axis and what is the y-axis. So you can find out here that this x-axis is the age and y-axis is the body water according to the percentage of the body weight. Different types of body water according to the percentage of body weight, right. So I can understand that how the body water is changing along with age of the person, that is given in this graph, right. So first we look at the total body water graph. So total body water, I can find out that the total body water is decreasing along with advancing age. So if I look at the curve at one go, and I can predict that the graph is showing that the body water, total body water, is decreasing with advancing age of the subject. Now look more closely. at this age or the x-axis. So this is the point of birth. Okay, so this line indicates this is the point of birth. So on your left hand side, this is before birth, that is the intrauterine life, and on your right hand side, this is after birth. Okay, 6 months, 12 months, and this is in years, 3 years, 9 years, 12 years, like this. Okay, so now we are trying to understand this graph more closely. Before birth, in the intrauterine life, look at this total body water. This is approximately 90% of the total body weight. Getting my point? So intrauterine life, fetal life, the body weight of the fetus is mainly due to water. And how much water is there? 90% of the weight is due to total body water. Getting my point? And this total body water will decrease gradually with advancing age, and it will reach approximately 60%. Look at here. So this point. So this is approximately 60% of the total body weight. And you can find out if you look at the age. So this is almost puberty. So puberty and after puberty, the body water is 60% of body weight. We have already understood this concept that total body water is 60% of the total body weight. Okay, and that percentage is reaching for the first time at which age? That is in and around 12 years of age, that is the pivotal age, right? So this is the first curve. And then another things, you look from here, you can find out that this total body water curve, there is no difference of boys and girls, no difference of male and female body water content up to this age group. Okay, means 1 year, 2 years, 3 years, 4 years, up to 12 years of age group, there is no difference of body water content, total body water content between boys and girls, between male and female. But after 12 years of age, the body water content of the male is more than body water content of female. We have already told this point before, but now you are looking at this curve and you are finding out that the body water percentage between male and female is different, and that difference is originating for the first time at which age group? At 12 year of age group. Means after puberty, the body water content is different between male and female. Male has higher body water content compared to female. Okay, so this is the meaning of this first curve, total body water curve. Now we are looking at the intracellular fluid and extracellular fluid curve. Intracellular fluid, we know in adult it is 2/3 of the total body water, and extracellular fluid is 1/3 of the total body water. But look at, in intrauterine life, if you look at this intracellular fluid volume curve, you can find out that intrauterine life, the ICF is lower than ECF. Getting my point? ECF is high, very, very high in the intrauterine life. But what is happening, if you follow this curve, then you will be finding out that ECF, although it is very, very high in the intrauterine life, it is gradually decreasing, and intracellular fluid, which was lower than ECF in intrauterine life, it is gradually rising like this. Getting my point? So intracellular fluid is gradually rising. Why? Because you know, whenever the fetus is developing more and more, organ generations is going on in the body, and more numbers of cells are generated within the fetal life, and that's why the volume within the cell is rising more and more. Okay, and extracellular fluid volume is decreasing. So please remember that at a point where ICF and ECF both are equal, this is the point. So if I plot a perpendicular on this, I can find out that after birth, at the age of 3 to 4 months, 3 to 4 month of age group, the ECF is equal to ICF. That means the ratio between ECF and ICF is 1:1. Getting my point? So if I ask you a question that our ICF is 2/3, ECF is 1/3, that is in adult. But at which age group the ECF and ICF percentage are equal with one another? That is the age group of 3 to 4 months after birth, right? And then ICF is rising further and ECF is decreasing further. And again, if we follow this curve, we will be finding out that up to the age group of this 12 year, there is no difference between boys and girls body water distribution. There is no difference between male and female body water distribution. Male and female body water distribution is originating at the age group of puberty or after that, right? So you must have to remember certain point from this curve, okay? That is more content of body water in preterm life. We have seen that in fetal life body water is 90% of the body weight, right? So here it is written that 70% of the birth weight of a term infant is the body water. Okay, so if I ask you what is the percentage of body water in a term infant, your answer will be 75% of the body weight is water. But if it is a preterm, okay, the water content may be 90% of the total body weight. Next is that by the age group of 3 to 4 months, I told you already, 3 to 4 month postnatal life, ICF and ECF volume become equal with one another, and that's why I told you the ratio between ECF and ICF is equal to 1:1. Very, very important for future MCQ. Then, if I ask you at which age group the percentage distribution is equal to adult percentage distribution, your answer will be puberty. But look at, by the age group of 1 year, ICF and ECF approaches towards adult level, means it's almost becomes 60% of the adult level. Okay, 60% of the total body water. Adult level percentage is reaching, it is going close to adult level at 1 year of age group. But if I ask you at which age group it become exactly equal to adult level, your answer will be it is in and around puberty. The body fluid percentage distribution as well as the total body water content, everything become equal to adult percentage in and around puberty, right? So puberty is very, very important. From puberty, the boys and girls body water content is also different. The male female body water content is also different. Plus at puberty, the adult level of body water is reaching, right? So if I ask you 60%, total body water is 60% of the body weight, this is reaching at which age group? That is at puberty. Okay? Right. Now next we are going to next topic, that is the measurement of body water. Right. How will you measure the body water? Okay. Simply you can say that if you know the body weight of the person, suppose the body weight is 70 kg, I know how to calculate the different body water, like for total body water, ECF, ICF, that I have already shown you. But always remember, that is approximate calculation of the body water according to the body weight. But if you want to measure the exact amount of body water, then what you have to do, you have to take help of a formula which is known as volume of distribution. Volume of distribution formula. Okay, so volume of distribution. You will also read this volume of distribution concept in your pharmacology. The concept is very similar. Okay, so what is done in this volume of distribution? I will tell you the formula, but before that understand. So suppose this is the capillary of a person. Okay, and these are the various cells of the body. These are the various cells of the body. So the water which is present inside the cell, that is known as the ICF. Okay. The water which is present just outside the cell, that is the interstitial fluid. Okay. So this is interstitial fluid. I'll write with a different color. So interstitial fluid, and the water which is present here is plasma. Inside the capillary is plasma. We all know that this plasma plus this interstitial fluid is equal to the ECF. We all know this thing. So if I want to measure body water from any of this compartment, first of all I have to inject one substances into the capillary of the person. So suppose I am injecting one substances into this capillary blood, and how much substances I am injecting? Suppose Q is the amount of the substances that I am injecting. Q milligram of substances I am injecting. Okay. What substances? It can be different. Suppose for this example I am taking inulin. Inulin is the substances which I have injected. Now, whenever you injected inulin into the capillary blood, inulin will be distributed evenly inside this blood, and then inulin will try to penetrate the capillary, and it is freely permeable to capillary. So what will happen? Now the inulin will also come out of this capillary and it will be distributed here also. Here means this is the interstitial fluid. Okay, and then this distribution will reach a point where there will be equilibrium between this plasma concentration as well as this interstitial fluid concentration. So there will be an equilibrium where inulin is distributed equally in the plasma as well as interstitial fluid, right? So now if I ask you that this substances, inulin, which you have injected, it is distributed in which volume? Your answer will be in plasma as well as in interstitial fluid. Can inulin enter inside the cell? Answer is no. Inulin cannot penetrate this cell membrane. So inulin will never distributed inside the intracellular fluid. Okay. But it is freely distributed inside the plasma. It is freely distributed inside the interstitial fluid. Means inulin is distributed inside the whole ECF. Now after this distribution has reached to an equilibrium, we have to take the blood sample from this person. So after a certain point of time, you have to take the blood sample of this person, and in that blood sample you have to measure the concentration of the inulin. Concentration. So you have to measure the concentration of the inulin in the plasma. Now, if you divide this total amount which you have injected with the concentration of the inulin in the plasma, then you are going to get a volume. Which volume? The volume in which the inulin has been distributed, and in this cases inulin has been distributed in the ECF. So if I divide total amount with the concentration of inulin, I am going to get the extracellular fluid volume. Getting my point? So this formula, okay, is known as volume of distribution formula. What is the formula? Total amount injected upon concentration of the substances after distribution. Now, inulin is an inert substance, so there is very less chances that it will be metabolized by the body. But there are certain substances which are easily metabolized by the body. So I have to consider the metabolism or the excretion part of the substances. So that way the formula is a little modified, that is Q minus E upon C. So if I write down the formula, so Q minus E upon C is the formula of volume of distribution, where E is the excreted or metabolized part of the substances. Because they are metabolized, because they are already excreted, okay, they will not come into the picture. So I am subtracting that amount from the total amount. So total amount minus excreted or metabolized upon your concentration, that is the volume of distribution. Now, the concept is that if you want to measure the total body water, okay, so suppose I want to measure the total body water, so I have to choose one substances such that whenever you inject that substances in the plasma, that will come out in this interstitial fluid also, and that will also enter in the intracellular fluid also. Getting my point? So if you want to measure the total body water, you have to choose a substances which is freely permeable to capillary also, freely permeable to cell membrane also. Then and then only it will be distributed at the level of this plasma also, interstitial fluid also, as well as intracellular fluid also, and then only you will be able to measure the total body water. Getting my point? So if I ask you one question, that the substances which is used for total body water measurement is permeable to capillary, true or false? Answer is true. The substances is permeable to cell membrane, true or false? Answer is true. Getting my point? So this type of question can also be given in future. Be careful. Now, suppose I want to measure only the plasma volume of a person. What type of substances I should choose? What will be the property? Only plasma volume means you have to choose on substances that will be only distributed inside this capillary. Okay, it will never go out of the capillary. So if I want to measure the plasma volume, I have to choose one substances which will remain inside the plasma only, which is impermeable to capillary as well as impermeable to cell membrane. Getting my point? So if you choose such a substances, that will remain only in the plasma, okay, and if you apply this formula, you will be able to calculate the plasma volume. Based on this concept, there are certain substances which are used to measure different fluid compartment, and this is a must-know topic for your MCQ, right? Means if I want to measure the total body water of a person, the substances which I will be using is D2O, deuterium oxide, or tritium oxide, or antipyrine. So these three substances, they are freely permeable to capillary as well as they are freely permeable to cell membrane. That's why they will be distributed in whole body water, total body water. But look at, if you want to measure only the ECA volume, I have already discussed inulin. Inulin is freely permeable to capillary, but it is impermeable to cell membrane. Similarly, if you use sucrose, not the glucose, because glucose will easily enter inside the cell, but sucrose, because it's a disaccharide, it will not be able to enter inside the cell. It will be distributed in the plasma as well as in the interstitial fluid. So again, it can give you measurement of ECA volume. Similarly, sodium isotope, okay, iodine isotope, I125 isotope, which is attached to it iothalamate, okay, iothalamate, right? As well as you can also use mannitol for ECA measurement, but the best substances is always the inulin, right? Now, if I want to measure the intracellular fluid volume only, what is the concept? Concept is that you have to choose such a substances which will be only distributed inside the cell fluid, but not in the interstitial fluid, not in the plasma. Is that possible? Answer is no, because you are injecting the substance in the capillary. So, bypassing the capillary, bypassing the interstitial fluid, directly entering in the cell, that type of substances is not there. So that's why the intracellular fluid is measured by measuring two volume, that is total body water you have to measure, as well as you have to measure the extracellular fluid volume, and if you subtract this, you are going to get the intracellular fluid volume, ICF. Similarly, if I ask you how to measure the plasma volume, you have to choose one substances which is impermeable to capillaries, and that is albumin. We all know that albumin cannot penetrate the capillary, but if you use normal albumin, that will be mixed up with the normal plasma albumin, right? So that way you have to use one iodine isotope, okay, I-125 tagged with albumin, right? So albumin tagged with iodine isotope, this kind of albumin can be used for measurement of plasma volume. Or another substance is also used, which is known as Evans blue, similar to albumin property. This is very, very important for MCQ. This Evans blue has been asked multiple times in examination. Then next is the interstitial fluid. Again, it cannot be measured directly. You have to measure the ECF volume, and you have to measure the plasma volume, and you subtract them, you are going to get the interstitial fluid volume. For measurement of only RBC volume, the chromium isotope is used. The iron isotope can also be used, that is written here. So all this thing you have to memorize in your brain, right? That what is the substances used for ECF, for total body water, for plasma. This is very common question in examination. Please remember this, right? So this is volume of distribution and different thing. Now we are going to discuss the next topic, that is a shift of body water between different compartment, right? So we have just discussed, okay, different types of body water compartment. Now we'll be discussing, if you give extra amount of different fluid, how this extra fluid will enter in the ICF or ECF, right? So this discussion will be based on a diagram which is known as Darrow-Yannetti diagram. So what is this diagram first? Okay, so I am drawing one x-axis and y-axis, and I am drawing one box, right? Okay, so this x-axis is the volume axis. On both sides, this x-axis is the volume axis, and y-axis is the osmolality axis. And this box, this whole box, this represents the total body water. This whole box represents the volume of the total body water. But as you can find out, this total body water is divided into two parts. So on your right hand side, you can find out this volume. This is smaller volume. So this smaller volume is the volume of the ECF, right? And on your left hand side, you can find out this big volume box. So this volume represents the volume of the ICF. So this is the volume of ICF, right? So the total body water distributed into two compartments, ECF on your right hand side and ICF on your left hand side. In steady state condition, the osmolality of your ECF and osmolality of your ICF, both are same to same, and that is here. That is the normal osmolality of your body fluid, right? And what is that normal osmolality? We all know that normal osmolality of our plasma or of our cell fluid is 280 to 290 milliosmol per liter, milliosmol per liter or per kg or air. So this is the normal osmolality of plasma. So in steady state condition, the ECF osmolality is same to same with the ICF osmolality, and that is 280 to 290 milliosmol per liter. Now, in this diagram, we have to understand that if you give hypotonic fluid or hypertonic fluid, then how this Darrow-Yenner diagram will change. Getting my point? So suppose I am drinking some water, or suppose in a patient you are giving infusion of 0.9% NaCl solution. How this Darrow-Yenner diagram will change, that we are going to discuss. But to understand this topic, you have to understand what is the meaning of this word tonicity, because we will be discussing the effect of hypotonic or hypertonic fluid or isotonic fluid. So what is the meaning of tonicity? You know that the tonicity word will be used whenever there are two compartments and two compartments are separated by a semi-permeable membrane. Okay, right. So try to understand this. Suppose this is a semi-permeable membrane, and on both sides of this semi-permeable membrane there are certain volume of water is there. Certain volume of water is there on both sides of this semi-permeable membrane. Okay. So on compartment A, suppose this is compartment A, it contains 300 milliosmol NaCl. If I give another 300 milliosmol NaCl on the compartment B, then both the compartments are iso-osmolar compartment, and if I compare this B with respect to A, then B is isotonic to compartment A. Getting my point? So tonicity means you are comparing two solutions when they are separated by a semi-permeable membrane. The effective osmolality of one solution in comparison to effective osmolality of the other solution is known as the tonicity. But for biology, or particularly for medicines, this reference solution is nothing but your plasma osmolality. So basically, for medical field or for medicine, tonicity means effective osmolality of a solution in comparison to plasma osmolality. Getting my point? So what is the meaning of tonicity in biology or in medicine? It is nothing but effective osmolality of a solution in comparison to plasma osmolality. And what is the normal plasma osmolality? That is 280-290 milliosmol per liter. So suppose you have made one solution which is 0.9% initial solution you have made. Okay, 0.9% NaCl solution means you have given 9 gram of NaCl salt in 1 liter of water. Okay, you give 9 gram of NaCl salt and then you make the volume up to 1 liter. That is the 0.9% NaCl solution. The osmolality of this 0.9% NaCl solution is approximately 290 or approximately 300 milliosmol per liter, which is exactly same to same with that of the plasma osmolality. That's why this 0.9% NaCl solution is known as isotonic solution because the effective osmolality of this solution is almost equal to plasma osmolality. So in medicine, we have to remember tonicity means effective osmolality of a solution in comparison to plasma osmolality. But the original concept of tonicity means when two solutions are separated by a semi-permeable membrane, the effective osmolality of one solution in comparison to other. Right. So next concept is that suppose in this solution, in this compartment B, rather than giving 300 milliosmol NaCl, suppose in this compartment I have given 200 milliosmol NaCl plus 100 milliosmol urea. 100 milliosmol urea. So if I look at the combined osmolality of this is 300, which is equal to the compartment A. That is, both the compartments are isoosmolar, but now both the compartments are not isotonic. Why? Because it contains urea. What about urea? Urea is permeable through this cell membrane. So what will happen? Whenever you give urea, urea is not an effective osmol. It is ineffective osmol. Why? Because it can easily penetrate this cell membrane and it will go to the other compartment. So what will happen? This compartment B will be hypotonic later on. Getting my point? So what I am saying, that because urea is an ineffective osmol, I am using the word effective osmolality in comparison to other. So initially, whenever you give 200 milliosmol NaCl and 100 milliosmol urea in this compartment, the total osmolality is same to same with that compartment A, means both of them are isoosmolar. But isoosmolar may not be isotonic. Why? Because in this compartment, one of the substances is urea, and the urea, because it is easily permeable through membrane, it will go to the other side and this compartment will be hypotonic. So please remember, isoosmolar does not means always it will be isotonic. It may be hypotonic also, it may be hypertonic also. Okay? But the more important concept that I have to remember is that in medicines, whenever we use the tonicity word, it is the effective osmolality of a solution in comparison to plasma osmolality. Right. So, how to calculate this plasma osmolality? Okay, that is the additional topic you have to remember, that calculation of plasma osmolality, all of you know this thing, is done by a formula which is 2 multiplied by sodium concentration in the plasma plus glucose concentration in milligram per dl, means milligram percentage, upon 18 plus, okay, blood urea nitrogen, that is also in milligram percentage, that is milligram per dl, upon 2.8. So this is the formula for calculation of the plasma osmolality, 2 multiplied by sodium concentration. Sodium concentration in milliequivalent per liter. Okay, it may be milliequivalent per liter or maybe millimole per liter. There is no problem. But you must have to remember that when glucose is in milligram percentage, okay, and blood urea nitrogen also in milligram percentage, then you have to divide this with 18 and 2.8 respectively, and you are going to get the osmolality of the plasma. But please remember, if all this glucose and blood urea nitrogen and sodium, all of them are given in SI unit, that is millimole per liter, then the formula will be like this: 2 multiplied by sodium ion concentration plus glucose, okay, in millimole per liter, plus blood urea nitrogen in millimole per liter. So I am writing here all the units are millimole per liter. Please note down, because in Harrison you will see that all the value has been given in millimole per liter. So in the question, if the values of glucose and the blood urea nitrogen is given in millimole per liter, you have to just use this formula 2 multiplied by sodium plus glucose plus blood urea nitrogen. You don't have to divide this 18 and 2.8 in the above equation, right? Now, whenever I am using the word blood urea nitrogen, it is not urea. Okay, please remember, urea upon 2.14 is equal to your blood urea nitrogen. This you have to remember. Okay, so sometimes in the question may be very simple. They will ask you calculate the plasma osmolality from this formula. Okay, and in the question urea is given. You have to convert the urea to blood urea nitrogen by dividing this 2.14. Urea upon 2.14 is equal to blood urea nitrogen, and then you apply this formula. Okay, now next thing is that calculated plasma osmolality is taking into consideration of 3 major ions in the plasma, right? What are those? This sodium ion, right, the glucose and the blood urea nitrogen. 3 substances in the plasma. They are not considering the other things, other osmolytes which are present in the plasma. That way, if you measure the osmolality, if you measure the osmolality of the plasma by some laboratory technique, okay, you send the sample of the patient to lab, and the lab will use a technique which is known as freezing point depression. Freezing point depression technique. This freezing point depression technique is used to measure the actual osmolality of the plasma in the lab. So this is known as measured osmolality. So calculated osmolality is simple by a mathematical formula, and measured osmolality is by a technique which is known as freezing point depression. You know, whenever you measure the plasma osmolality, it will be always a little greater than calculated osmolality. That means the measured osmolality MO minus calculated osmolality CO is approximately 10. Measured osmolality takes consideration of all the osmoles which are present in the plasma, but calculated osmolality is taking consideration of sodium, glucose and blood urea nitrogen. That's why there is a little difference between these two, but this difference is never beyond 10. Never beyond 10. Measure minus calculated. If this osmolar gap, so this difference is known as osmolar gap. If this osmolar gap is higher, okay, suppose it is higher than 10, then you have to think of certain substances which are present in the plasma which has raised the measure osmolality to a very high level. Certain osmolytes, additional osmolytes are present in the plasma which is not taken into consideration by calculation, okay, and that's why the osmolar gap is higher. So increased osmolar gap will be seen in certain condition, like for example, huge amount of alcohol is present in the plasma, like for example, ethyl alcohol, methyl alcohol, okay, so alcohol poisoning, ethanol poisoning, methanol poisoning, everything, right? Second thing is then certain kind of sugar can also increase this osmolar gap, like for example sorbitol, okay, you know. So whenever this sorbitol concentration increases in the plasma, your plasma osmolality by calculation will remain same, but the measure osmolality by freezing point depression will be very, very higher. So that's why the osmolar gap increases. Similarly, if huge amount of protein, hyperproteinemia is present, then also the osmolar gap increases. Similarly, if huge amount of lipid is present in the plasma, hyperlipidemia due to any cause, that can also increases the osmolar gap. So please remember, normal osmolar gap is 10, but if it is greater than 10, that means some unmeasured osmoles are present in the plasma, maybe in the form of alcohol, maybe in the form of sugar, maybe in the form of protein, or maybe in the form of lipid. So these are the applied things that you have to remember about osmolality and all. Now we have understood the concept of tonicity. We have understood the concept of osmolality. So now we'll go back to the Darrow-Yannet diagram. But before that, I'll show you certain examples of isotonic solution which we